4, 3.
Good evening. I'm Gary Christenson, Mayor of Malden. Today marks the anniversary of the Boston Marathon bombing. Each year on this day serves as an opportunity to reflect on the resiliency, perseverance, and compassion of the people of Boston and the surrounding cities and towns to help each other navigate through that terrible time. Those same qualities are happening once more during this unfortunate healthcare crisis that we are all working through. From our healthcare workers to our first responders, to people working at our supermarkets, to our truck drivers, sanitation workers, and of course our volunteers. We want to, at the outset, say thank you, thank you, thank you. Unfortunately, we also want to report that we now have 414 confirmed cases of COVID-19 here in Malden. And unfortunately, we've had 4 deaths as a result of this virus. Our hearts go out to the victims and the families during this time. Now we are going to get into this evening's update on COVID-19 here in Malden. Our guest this evening, our Stephen Ultrino, representative for the City of Malden, as well as our Healthcare Director, Chris Webb. So as always, what we're going to do is have them make a brief opening statement, and then we are going to get to the most important part of tonight's show, which is your questions. Before I turn it over to Representative Ultrino and Health Director Webb, we do want to say thank you to Malden Access Television for having us here this evening. We're also joined by Maria Luis, the Chief of Staff of the Mayor's Office, and Ron Cochran, our Communications Director. So with that being said, let's go to our State Representative, Steve Ultrino, to find out what's happening at the State House to help our city get through these tough times.
Thank you, Mr. Mayor. It's a pleasure to be here, and thank you to MATV. And I want to thank you, Director Webb, for all the work you've done since day one when this really broke. You were the first person I called because of all the calls I've been getting. And if the state could be of any more help, especially Department of Public Health, please continue to reach out. But thank you to the people of Malden. My office, my aide and I, we've received hundreds of calls just over the last 3 weeks that we've been tracking, and most of it has to do with questions regarding unemployment or health care or any state resources other than the CARES Act, which is federally regulated. But the governor spoke a few hours ago and updated the Commonwealth on our COVID numbers, and we're up to, unfortunately, 1,108 deaths in Massachusetts, 29,918 total positive cases in the Commonwealth, and that's out of 132,000 or so people who were tested. So the Commonwealth, over the last few weeks, on a daily basis, has almost tripled the amount of those that we're able to test. We're still trying to get more COVID-19 tests in order to expand those that we're testing. The governor did announce an $800 million bond for healthcare workers, to test healthcare workers and also to offer hazard pay. Our nursing homes, our healthcare facilities are in dire need not only of staffing, but of PPE equipment and just reaching out to the community for help. And unfortunately, a lot of 44% or so of the deaths of the 1,100 or so have been those that reside in nursing care centers. And you folks have heard about the tragedy in Holyoke veterans, as well as those in Chelsea. And not only is the Attorney General, but the U.S. Feds are actually investigating what has happened in Holyoke. So my thoughts and prayers go out to the families and our veterans, but know that the state has stepped up and is really taking action on the day-to-day at Holyoke. We're opening up more beds. We have 1,000 beds that have opened up in the Convention Center in Boston, or the Expo Center, I believe, in Boston. A couple of hundred of those are for homeless people. So we've worked with Mayor Marty Walsh to try to get those that are in Pine Street in and those folks that are on the streets into beds at the Expo Center. We want to thank the Teamsters for really putting those 1,000 beds up within a week or two. And that's to help the overflow of the hospitals. They're not ICU beds. They're to help relieve some of the ICU beds that are in our major hospitals. You probably don't know, but our hospitals are losing about $1 billion a month in revenue from elected surgeries, like a hip replacement or some sort of surgery that we've actually put off. So we actually are trying to help our community hospitals to stay afloat, believe it or not. We actually expanded healthcare services. We're covering in full, whether it's Mass Health or Medicaid, any COVID-19 related illness, so that you wouldn't have co-pays or anything like that. We have approximately, now these numbers, as Director Webb would know, are probably obsolete from 4 o'clock today when it's now 7 or so. But we have about 800 or so beds left for ICU, and the governor is monitoring those. Any updated information, you can go to mass.gov/COVID-19, and you can check out how much PPE equipment we're sending out in the state, where our beds are. We're doing it by region now. We're planning to open up 5 centers around the state, like the Expo, to help all those that are in maybe Central Mass, Southern Mass, Western Mass, Northern Mass. Our hospitals, we're very fortunate. I've been on a few conference calls every day of what our healthcare workers are doing. It's just absolutely amazing. One last thing, and I'm probably forgetting stuff, but everything I have that's been passed by the state up until 4 o'clock is on my website at representativeultrino.com. But we did pass, thanks to Representative Donato, who is running our informal sessions at the State House at least 2 to 3 times a week. We did pass the housing bill. It was in conference committee between the House and the Senate for the past week or two. The governor did state he will sign it without any vetoes or additions tomorrow afternoon, which is Thursday the 16th. Just a few things, because I've gotten a lot of calls about the housing bill. One is there's a moratorium on evictions and foreclosures for owners. It prevents landlords and property owners from terminating tenancy or send any notice to quit for non-essential evictions. It will prevent judges from denying a stay of execution. It prevents enforcing non-essential evictions of landlords or opposing late fees. It does not alleviate a tenant from paying their rent. Now, a landlord could say, because on my street alone, I have a lot of 2 and 3 families. Many of my neighbors rely on their downstairs tenants' rents to pay their mortgage. There is going to be mortgage protection for those homeowners. Up until 180 days from your bank, they can add it on to the end of your mortgage. You could also use the security deposit to pay the bills for that house as well. And I will have, and this is good for 120 days after the effective date, which is April 16th, or 45 days after the end of the state of emergency. So I'll have an outline for you on my website sometime this evening, because besides the hundreds of calls that we're getting on unemployment, we are caught up. We did hire 500 temps to staff the Department of Unemployment. We received a couple of 100,000 claims a week. More, usually it's like 13,000 or so. We are meeting. We had economists come in yesterday to meet on revenue for next year. Again, these numbers could change. We're looking at a $4 to $6 billion loss in revenue for fiscal year. That doesn't include these 3 months, and it doesn't include the added expenses we're taking on. So, but again, my office, you can reach out at 617-722-2460. Even though we're not in the State House, we check it 4 times a day. Or my email is stephen.ultrino@mahouse.gov.
Excellent. Thank you very much, Rep. Ultrino. Director Webb? What's
Good
the
evening,
latest?
everyone. I'm back again with some pretty good news, I think, as it goes, right? We have 35 new cases, bringing our total to 414. Our contact tracing has improved remarkably with the addition of the school nurses. They're doing incredible work, absolutely incredible work. The problem we're having reaching out to some people is it's a very simple problem. They're either not well enough to remember to give their phone number, believe it or not, or the communication gap might be there. So we're having a little bit of trouble with phone numbers. But if you're expecting a phone call and you haven't been spoken to yet by a public health nurse, feel free to call in. We'll look up your case number and sort that out. Or just send an email to Board of Health, boh@cityofmalden.org, and I will make sure that gets down the hall, and we'll dig that out and get the phone call that you need. Some people are, they're feeling worse, so they need someone to talk to and get some advice. So we want to make sure they get that. We're taking a good hard look at nursing homes this week. We have one that's being challenged right now, but they have a plan. They have made all of the requisite requests for support, and I think it's just a matter of time that they'll get it. Okay. And we're going to, Captain Cronin and I will be working with them to keep chasing that, making sure that people know that they're in need. It's not a crisis point yet, but we don't want it to get there first.
Okay.
Before we respond.
All right, so we're at the point now that as this show has evolved over the past several weeks, we've borrowed a segment off the hit show Around the Rim, hosted by Nesta Dudley, which is called In the Web. So this is where I get to ask you one question, and you can't avoid answering it. You can't send it to committee or, say you'll get back to me.
Yeah.
You have to answer it on the spot. And then we're going to get to the public to hear what they have to say. But on the state budget,
Yep.
do you see the state coming back in this fiscal year to reduce local aid to cities and towns?
This fiscal year, I would highly doubt that.
Okay.
It's not, I'm one
You
of
haven't heard that.
160.
Yeah.
We do have a rainy day that Moody's, our bond agency, is asking us to be careful with.
Okay.
But local aid has always been a top priority. The cost of our healthcare system, which thousands of Maldonians take part in,
Right.
could take other aspects of the state budget, but I couldn't see a lot of support in the House, to do anything to schools or cities
In the
and
current
towns.
fiscal year.
In the current
Yeah,
fiscal
yeah.
year.
Next year's a whole different, I get that. Yeah.
Yeah, I would be lying to you if I
Right.
said anything.
No, we understand.
And I just wanted to, Mr. Webb, we are working on, you mentioned nursing homes, we are working on legislation to give local Department of Public Health more authority to do enforcement in local
Thank you.
healthcare,
That'd be
nursing
helpful.
homes and stuff
That
like
would
that.
be helpful.
So I apologize, I
No,
forgot.
that's great.
but
We have
we
good
have so
working
much out there.
relationships with all of them, but
Right.
that's
But some
there's
don't.
always that moment.
Right,
Yeah.
some don't, and
Yeah.
that's why the legislation.
Okay.
Sure, that's helpful.
All right, now for you, Mr. Webb. As May 4th gets a little bit closer, the question is starting to come up again about whether or not you see that as a realistic date that kids will be going back to school. What is your honest assessment of where we are with respect to school?
I don't see us going back to school this year.
Okay.
For the simple fact that there's some evidence early on that young kids are carriers and don't get the symptomatic response that adults would get. Why, they don't know. But I'm going to stay with that's a huge pool of infection. So
Okay.
putting them back to school probably doesn't make the most sense. If you wanted to do maybe a senior class abbreviated thing where you could spread people out and use larger rooms to do that, that would be something that could be done. But I don't think full school is going to happen this year. I don't think it
What
can.
about the fall?
I think in the fall we will, but it will be different.
Parameters? Yeah.
Yeah, there'll be less congregate play outside. There'll be less. There may be there'll be temperature checks. There'll be if someone's coughing, they're going to be wearing a mask. Even if it's an allergy, but it's for the time being, that's what probably will happen.
So when we get back to normalcy, it'll be a new normalcy. It's not going to be the way things were.
No, I don't think so. I mean, I don't see how it can.
Right.
If we want to really just put this virus to bed.
Right.
It does have, some viruses do flare up again years later.
Yeah.
Some of them are stronger, some of them are a lot weaker.
Yeah.
So we will need to be prepared for that. So to change our behavior or to say we'll never have to do this again probably isn't true.
Got it, okay. All right, just one update from the mayor's office. We do want to say thank you to Evan Spatrini, Alex Pratt, Debbie Burke of the Malden Redevelopment Authority, who I think within a week's time were able to utilize the money that we received from the CARES Act, thanks to Senators Warren, Markey, and Congresswoman Clark, and turn that into a proposal that was sent to the City Council, who I also want to thank at the outset for agreeing to support it as is and on the same night that it was submitted. So basically, of the $821,000 that we received, $500,000 of it is going to go to a rental assistance program, and the balance will go to help Malden's small businesses. So Kevin Duffy worked with Joan Ford Margeau from the Chamber of Commerce, and now we're going to start working out the details. But if you see your city councilor, they do deserve a pat in the back for being able to rally together to pass this bill last night. So with that being said, let's get to the questions.
Okay, first, Mr. Mayor, we'd like to thank Malden Access Television for persevering through some technological issues that we had last week, and so hopefully my audio, which was a little bit shoddy last week, is all great now, and we're actually able to show some things on screen, which we'll get to, as well as me. So thanks to Alonzo and the rest of the team. Our first question comes to us from a YouTube live question. And Kristen asks, how many people have recovered in the city of Malden?
Okay, Mr. Webb?
It's a great question, but it's almost impossible to tell right now.
Okay.
I would say...
How come? Just because it's so fluid?
Because, yeah, it is so fluid, and so the people, no one's really sick for the same amount of time. So what we're finding in our calls is we may get 7 days into a case. We'll call them and see how they're doing, and they're done. They feel fantastic. The next person you call, they're on day 7. They can't get out of bed. So there's no checkerboard point where you know your recovery starts to, or is completed. I would tell people that even though you have recovered, having had it, I know everybody's talking about antibodies and immunities, but it's not proven yet. So I would suggest to people, until we know for sure, if you've been sick, wear a mask when you're out. Don't interact with anybody without a mask on, because you may still be shedding virus. It just isn't making you sick.
Okay.
So.
Okay, our next question is regarding the bill that would allow, whether or not there's a bill to allow the waiver of the MCAS exams for students.
Okay, let's go to Rep. Ultrino.
Sure. As you probably have heard, we did pass a municipal relief bill, and one of those, one of the aspects of it was to allow the commissioner to not offer the MCAS this year. That does not include seniors in high school, but the commissioner, as Mr. Webb said, you know, do we go back to school or not? I think the commissioner is in the same boat. So we did allow the commissioner to use his judgment. There have been some school districts that have asked to do the MCAS, especially in biology, because students take it in the 10th grade. So that's why we left that piece in for the commissioner to work with those school districts. And there are a handful of seniors that have not passed MCAS around the Commonwealth. But we also told the commissioner if they did not pass the MCAS, what other graduation requirement could he do in lieu of that? But again, we don't know if we're going back, if seniors will ever sit back in the classroom. So that's why we allowed the commissioner and the Board of Education some leniency on that. But there'll be no MCAS otherwise.
So Rep. Ultrino, based on what Mr. Webb said, why not announce sooner rather than later that school will not be back in session for the remainder of the school year? What are you hearing up on Beacon Hill as to why they're not making that call sooner rather than later? Or are they getting ready to do that?
Well, you know, no matter what you hear on TV, we need to make sure that this is not an emotional of course it's emotional, but we need to make sure if we're going to call people back to school or back to whatever, two things is you got to track the data. And I'm not saying that because we have a public health person here. But
We love data.
Right. Public health people, not elected officials, should be making that call.
Got it.
And I give Governor Baker a lot of credit. Secretary Sutters, or Commander Sutters, as she's the commander of the COVID-19, is doing one hell of a job trying to track the data. And, you know, the schools are very important because, you know, I was a classroom teacher, as a school principal. You have 25, 30 kids in front of a teacher. And if they're little, they're hugging the teacher, grabbing on their shoes,
Right.
reading time, sitting on a mat. So I don't know I think the state is hoping that something can be done,
Okay.
but they're not foolish either.
Yeah.
Because when do you say, hey, listen, if school ends in Malden, I don't know, June 19th, is June 1st too late?
Right.
Because the teacher's going to need a couple of days just to get back into everything. So
So you think we'll hear
they're
something?
working on a plan.
Yeah. Okay.
Because, you know, as I speak to Superintendent O'Terry twice a week, and, you know, as much as we're doing this online stuff and these Google Chrome, nothing is as
Right.
effective
Right.
as the classroom. So I think the commissioner, who is going to get his approval from the public health,
Right.
and
And so they're just not there yet to make that call.
they're meeting every
Right,
day.
right,
They're not telling us
Right.
that yet.
Right.
But at some point, and you know, I think someone during our Ways and Means hearing yesterday, when the economist says, "Hey, listen, you could tell people tomorrow everything's open. The people are going to determine when they want to go to a restaurant, the movie theater, go in an elevator with 4 or 5 people," and that's why we're projecting that we're not going to see unemployment numbers pre-virus improve till about 2022, 2023.
Yeah, I read that. Yeah. All right. Let's go to another question.
Okay, so we do have our first caller of the evening. So we're going to go to Susan. Susan, go ahead. You are on the air with the panel.
Good evening, Susan.
Hi, ma'am, Miss Christenson. I'm coming across a frustrating dilemma in trying to get my prescription filled at Stop and Shop Pharmacy.
Okay.
I'm a senior citizen. I go out as little as possible because I have a compromising condition. And senior hours is when I shop, and the pharmacy doesn't open till 9. So since Monday, Tuesday, and today, I've walked down at various times. The line is very lengthy, and because of my back, it just can't handle standing for all that time. And today I asked the police officer at the door, can I please, I had the prescription in my hands, and I said, can I please just go in and drop this off? And was told I had to go to the end of the line. Can there be any provision for this?
Let's ask Mr. Webb. Anything come to mind?
I think we can work something out for that. Yeah, I mean, maybe we'll have with the way Stop and Shop is set up, the pharmacy as you face the building is on the left-hand end. We could open that door, which isn't currently being used for anything except interior egress. We could probably get someone to monitor that door and let pharmacy patients go in. It would be a very short walk to the pharmacy
How
counter.
soon could you put that in place?
Tomorrow.
Susan, so Mr. Webb could put something in place that will help you tomorrow. Do you want to give Mr. Cochran your contact information so we can follow up with you in the morning?
Do they deliver
Sure.
like CVS
All right.
does?
Yeah,
No, they
because
don't.
even if you tell the officer, I told him he could follow me, whatever.
Yeah, no.
I can't be the only person with this problem.
Right.
Right, I think Mr. Webb has an idea that might address it, but we want to help you in the meantime. So if you can, Mr. Cochran, can you get her contact info offline?
I would not be able to do that. Terlanzo may, but I would suggest that she takes down the Board of Health's phone number, and that would be 781-397-7049.
Wait.
Yeah.
781.
So can you put is Mr. Finn on notice? She may be calling.
Yeah, we'll take care of it, yeah.
Is she all set, Ron?
One more time, Susan, I'll give it to you. It's 781-397-7049.
397?
7049.
Say the last four numbers again, I'm sorry.
7049.
And I call this when? Tomorrow?
What time?
Tomorrow at lunchtime.
Yeah, can you call tomorrow, Susan, around lunchtime?
Okay.
Yeah,
All
and
right.
just
Thank you
and
so-
Susan, just
Yeah.
say you're following up from tonight's show, and
Okay.
they'll know who you are. Should she
All
ask
right,
for anybody
thank
in
you
particular?
so much.
I'll be answering.
We'll
your
help
phone.
you out. All right.
All right, thank you.
All right, Susan, hang in.
All right,
So, Mr.
bye-bye.
Webb, you could put that into place tomorrow.
Yeah, I think so. I'll just call the store manager. We'll work it out.
Okay.
Whether we have the officer or the other door, we'll get something going.
Okay, our next question comes from Joe. Joe on YouTube, who's watching us on the YouTube live stream of MATV, asks, are face masks available for senior citizens? Where or how can they get them?
Good question.
Well, I don't know of any stores that are carrying bulk supplies, but what we can do for people who are living with someone who's diagnosed, if you want, can bring you some masks to get you through a couple of days until you can find your own supply. But we will help you out with a positive case each and every time.
So they should call Ron. Do you want to give that phone number again?
Sure,
Or
we'll
type
give
it in.
that. Yeah, that's the health department's phone number, and that's
We don't have
781-397-7049.
Small hidden supply.
Yeah, another suggestion, Mr. Cochran, is maybe also give them MaldenNeighbors.org, which is
Yes.
a great organization. I know they're receiving donations of masks,
Yes.
so they might be a source that could help the viewer.
Yeah, I'm going to go ahead and share that on my screen. So if those in MATV studio can switch over to my view, sharing the Malden Neighbors Helping Neighbors website. So there's quite a few things that you can do here. And again, the URL, as the mayor pointed out, is maldenneighbors.org. And there's places where you can either offer help yourself if you're in a position to volunteer. You can request help. A lot of their activity is through Facebook, so you can connect to their Facebook account, and they give kind of an overall summary of this. And that group has been really active and really helpful to the community. So again, maldenneighbors.org. We're going to probably reference them quite a few times this evening. Okay, our next question is, one moment, we are on Facebook. How can SNAP recipients receive food deliveries online? So using services like Instacart or Peapod or those, are SNAP benefits available to those online grocers?
Who wants
Yeah.
to take that?
Cu-
Rep. Ultrino?
Currently, thank you, Mayor. Currently, they're not. So we have, we filed a House docket, or almost like a piece of legislation, because it's regulated by the feds. The state has some leniency on delivery of SNAP benefits, but currently you cannot. So we are working on legislation, which I think was filed on Monday, not only to use online, but also to use for curbside delivery of food that's purchased through SNAP. But currently they're not.
And what do you think, Rep? How long, is this a fast-moving bill, or?
It wasn't, the housing one took precedence over it, but they are meeting, we're meeting tomorrow in an informal session, and I'll I'll call the Speaker's office tomorrow and see if there's any movement on that. I don't know if it might be like a software thing. So say you order from Peapod. Peapod may not recognize that as a form of payment. So even if we had a law, and this is not Bible truth, but even if we had a law stating you can use SNAP benefits on Peapod, for example, Peapod or Amazon, Fresh Foods, whatever, may not have the software recognition currently that says that's a form of payment, like Visa, MasterCard, or a bank debit. So I'm not sure if it's multi-pronged. A, give the authorization. B, do the stores have that capacity under the billing? So I will check that out, and I can get back to you, Mayor, or your staff, and
Yep. Yeah,
and
that'd be
you can
great.
reach back out to the callers.
Okay.
Yeah.
And as always, our questions, we'll go ahead and follow up, for any unanswered questions after the
Right.
fact.
Thank you.
And get back to these folks. Okay, our next question is in regards to evictions. There was some mention about freezing of evictions, and there was legislation to freeze evictions. When's the anticipated time for that to be signed into law?
So today is April 15th. The governor stated that he will be signing it on April 16th in the afternoon.
And it takes effect.
Yeah, we have a preamble to the piece of legislation, and it states that usually it takes like a certain amount of days, but this will be effective immediately upon signature.
And you said for the duration, 45 days after the end of the...
45 days it shall expire 120 days after, excuse me, it should be 45 days after the end of the state of emergency,
Or did you
or
say
120 days effective after the date it's signed,
Got it.
which is tomorrow.
Now, Rep, I was asking Senator Lewis last week.
Yep.
Does that retroact back to the start of the emergency? So if someone was notified March 12th that they're being evicted, is that...
That I don't know. I will have to get, but that's a good question, because this just passed at 4:30
Okay.
this afternoon. So I will.
But the
I'll
good
get
news
back
is,
to
I
you.
mean, this is going to cover a large swath of Malden residents.
Sure.
Evictions and what's the other component in there?
Um,
Foreclosures?
Foreclosures for those that own property, too.
Right.
Yeah, we're
Yeah.
directing the banks to do that, yeah.
All right.
There was a follow-up, which is some of the concern was, although it seems like that protection was being put in place, there was some fear there that although they knew it was coming and they knew that the courts were closed and not taking any additional hearings, they were hearing that evictions were still being filed. So that was probably the biggest concern, I think, goes to what the mayor was saying about the
And do you want to
date.
speak to that? Because I think you have clear language in there, right?
Right. It does not prevent people from paying. So if, for example, someone's, after the state of emergency is over, if someone owes, their landlord 3 months' rent, unless the landlord works something out, which they're not required to do, they still owe the landlord that amount. The landlord could also utilize your security deposit for any expenses during the state of emergency.
And what about to the viewer's other question, Rep, that although you can't be physically evicted, can someone still be notified they are being evicted?
It says it prevents any court having jurisdiction over the eviction to process from accepting any filing, summons, or complaint for eviction proceedings.
Okay.
It also prevents a judge from denying a stay of execution for continuance.
So it's pretty airtight.
Yeah.
Yeah.
Right.
Okay. All right. Let's go to our next question.
Okay, our next question is from a caller. So Roxanne, go ahead. You are on the air with the panel.
Hi, Roxanne.
Thank you very much. This is Roxanne Reddington Wild. I was listening to Rep. Ultrino answer on the question of can you use SNAP to order and pay online for groceries to be delivered. As he correctly said, no, at the moment you cannot pay online using SNAP. However, DTA and the SNAP Coalition at our call yesterday, we were discussing this. People can place an order online and pay at the store, such as Stop and Shop, when they pick up. The rule on SNAP at the moment is that people must be essentially paying in person with their EBT card.
Okay.
All right. Roxanne, careful. We're going to add you to the panel.
Oh, I hear from Roxanne. I hear from Roxanne quite a few
Yeah,
times.
well, it should be noted. I just
Yeah.
heard from her a couple hours ago because we had
Yeah,
our first
you guys are great.
Affordable Housing Trust Fund meeting today, of which Roxanne's a member. So
No, she's a great advocate, and thank you for that. I will update my staff on that. But I think it's a
And
fraud issue too, where the law probably came in effect where you couldn't buy online because of identity fraud or something like that.
Yeah,
but
Yeah, it's a federal rule apparently.
Okay.
Rep. Ultrino, I will send you, and I'll also send Karen Hayes the SNAP Coalition's update that came out this afternoon when we
Oh.
were doing the Affordable Trust Fund
Great.
meeting.
Thank you.
very much.
Okay, bye-bye.
Bye.
Right.
Okay, our next question is in regards to statistics. We're going to probably bundle a couple of different questions in. Two-parter. The first is about contact tracing, if you could explain kind of how that works. And the second is, why does it seem as though there tends to be a disparity between the numbers that you might see on our website, numbers that get released in a press release, and then numbers you might see come out from the state?
Okay, Mr. Webb,
Okay.
how do you want to start? Contact tracing? Or?
I'll start with the contact
Contact.
tracing, which is kind of it's an interesting process. Someone gets diagnosed by their doctor or a laboratory. That laboratory will then put that diagnosis into the Maven system. That in turn sends that out to each city and town, is on the Maven system. The public health office at that point gets a list of people who have been tested. We acknowledge those, and then we break those out, give them to staff nurses, who are then calling those people, and this is where the trace part comes. They're calling the contact to say that we've confirmed you're positive. Who do you live with? How many folks are there? What kind of home do you live in? Is it a single? Is it a multi? Things like that. So then what we try to do is get a general conversation going to see whom they may have had contact with. What would classify as a close contact based on time frames, relationship, and the type of house you live in. So those conversations usually take about 30 minutes each.
So is this a new system?
No, it's a system used that closely resembles a foodborne illness outbreak. It's a different form, but the process is exactly the same. No one ever expected a foodborne illness outbreak of this magnitude,
Right.
but it's applicable and it's working really, really well.
Okay, and what was the other
Now,
part of
the other part where the statistics are
Vary?
reported differently.
Yeah.
A lot of that has to do with the time of the day that the person collects that data from and from the source they get it from. Our data is only as good as the material we're working in. So we have hundreds coming in, and we're working in the first 35, so we'll acknowledge those. Once we acknowledge those, that goes to our count. Everything after that is waiting. It's in queue, but it's not processed, and we can't count it until we open it, make sure it's ours, make sure that it's got the information that we need, and then it's put out to the nurses to get all that information. The other problem is there's lag time in the whole system. Keep in mind there's at least right now 500, probably about 1,100 people putting in data all day and night. So
at the state?
They're at Partners Healthcare in a room
Oh,
somewhere, and
yeah.
the basements here, and
that's all filtering to DPH?
it all filters in on different platforms into the Maven system.
Oh, yeah.
Then the Maven system has to digest that and then parse that information out in the data set that we're keeping. So they take some information, it loses other, and sends it to other databases and things like that. That process takes minutes, but for one case. But when you're doing 1,000 at a time, it can bog down and it can actually stop the system. So that's why it really is a volume issue. And our concern, obviously, as we start to test more and more, the people who are doing these contact testings calls are we're going to have more of them as well.
Got it. Okay.
And may I add to
please,
that?
please.
First thing on the contact tracing, we're adding about 1,000 staff members statewide, mostly working from home. The governor put that initiative in last week, I think, because as Chris said, you interview someone for 30 minutes. There's more to that than just the 30 minutes. So we're hopefully by the end of this week, the beginning of next week, we'll have those 1,000 people in place on the training and stuff like that.
So you both sold on this strategy?
Yes.
Yeah.
Oh, yeah.
Yeah, definitely.
It should be. You
But
shouldn't
it's
even have a technical term because.
But it's intensive, as Mr. Webb was saying, right? I mean, this is going to take a lot
It's
of.
as good as the data they're given.
Right.
So if there is a positive case, and they say, okay, who do you live with? Did you go? Did you do this? And then they say, oh, I forgot to tell the person I went for coffee with. it's
it.
as good as the data is given. So
But it's
these
better than
folks will
what we
be-
once
yeah,
had, which was
these
nothing,
folks
right?
will be trained on.
Right.
You know, it's like tracking a foodborne illness, or like if there's when I was on the call, if there's a factory that put out hamburger and the hamburger was tested with E. coli, where does that factory sell to? Oh, they sell to these so many stores, and they trace it from there, and that's why they recall lettuce or hamburger or something like that. Also, on the number of testing, you know, at the beginning we were having DPH state was having trouble getting accurate data from the hospitals. Not only just the number of tests, but how many beds do you have, ICU beds? You know, they were putting people in hallways. Do you count that as a bed? So right now we have a minimum of 264 sites offering tests. And the National Guard is now doing, not roadside ones, but we did one at Foxborough for you know, law
First
enforcement
responders,
and
yeah.
stuff like that. We're opening up drive-by ones. I think Medford did
Right.
one a couple of weeks ago. So you have a minimum, just a minimum of 264 test sites inputting the data. And then you also have data, as we were talking before the show, of people who might have had a heart attack and cause of death was heart. Then when they get to the medical examiner, they're actually may have been tested positive for COVID, and now we change it in adding another number. It wasn't, the heart attack was because of the COVID-19 or vice versa. I think New York just came out with thousands of more new cases because that was not the underlying cause, but they tested positive.
Right.
So I think even after the crisis may be over, those numbers will be changing for months,
If not a year.
if not a year.
If not a year.
Right.
There'll be reclassifications of every death
Right.
that is happened during this time period.
Right.
But to the point of the contact tracing, that program we love it.
Right.
We love it. It was brilliant. Whoever came up with it, brilliant. The focus that local public health is looking for is on labs. We need more labs. That's key right
Right.
now. And I know that's a process, and we want it to be a process because you don't want someone doing it halfway.
Right.
You know, we want the best results we can get. We want to minimize the false positives and the false negatives. So it's a process that we have to pay attention to, and I think that's what they're doing. And as soon as they can stand that up and start testing everybody and giving people better, you know, even just to lower people's anxieties, and give them, well, I'm not positive. I'm going to wear that mask. I'm not, you know, that's important, and we can then use that data based on ages, sex, race, to see what can be done and by whom. You know, and what age groups are, you know, there may be an age group that isn't touched,
Right.
but I haven't seen one yet.
Okay.
But that's the study we'll be making.
All right. Does that answer it, Mr. Cochran?
Yeah, that about covers it. And we've had Patty on the line, who's been very patient, and we want to get to her question as well. So, Patty, go ahead. You are on the air with the panel.
Hello, Patty.
Hi, Gary.
Yes.
This is Patty.
Hey, Patty, how are you?
Trying to survive, but
Yeah.
it's not easy. But,
Yeah, but if there's anybody
I'll-
anybody that can do it, it's you, Patty.
I just hope and pray, like, Stop and Shop and go back to the regular, you know, instead of staying in a long, long line. Like, I'd like to know, you know, what do you do in the if it's pouring rain out?
Okay, what about weather conditions? Is there much that can be done?
Not that I can think of.
What's the current
really.
setup there at Super Stop and Shop? It's how many inside and how many out?
They can have a maximum of 50
Even if we wear
outside,
the mask.
which is 300 feet,
Yeah.
Gloves.
the line.
Go
You
ahead.
want to say something, Patty? So, and they have a small area that is covered. That would hold probably 10 people with a 6-foot line. So no, there's really not a lot to do on those inclement weather days. I did find that during our inspections on those days, there weren't very many lines at all, and there were very few people in the stores. So I think a rainy day is a good day to go shopping.
Okay, but nothing you could see to require to mitigate bad weather. Have you seen
No.
any other city or town requiring covering?
Coverage,
or
no. Now, again, if you put people in the tent,
Oh,
they're
yeah.
going to be that much
Confined.
closer.
Yeah, yeah. Yeah, so Patty, we'll look into it, but it's not much we think we can do right now.
Yeah, and I
Just
hope.
try,
I
just
mean,
just try to go on those off hours. What time have you been going shopping?
Oh, in the afternoon, but what's the off hour? Is it,
What time they
6
open in the morning?
a.m. to
Yeah.
7 a.m.?
Yeah, what is it in the
I
morning?
think on a good rainy day, you could go at around 9 o'clock.
But what is it for seniors in the morning?
In the mornings, they have the first hour of their day. If it's an 8 o'clock opening, it starts at 7. So that hour is for 65 and older.
Yeah, Patty, if you can, I would try to go first thing in the morning.
Yeah, 6 a.m., right?
Yeah,
Well, 7 a.m.
Is it
Oh,
7?
7 a.m.
7, yeah.
yeah,
7 to 8.
a.m.
Yeah, 5 a.m. I mean, 6 a.m. I have to get up at 5
You can
Yeah, I
sleep
know.
in and go at
5 o'clock in
7.
the morning. I don't think it's daylight then.
Yeah. But that's what I would do, Patty. Try to go first thing because it's limited on who can be in there at that time. So
Yeah,
I think you'll have a better chance then, okay?
all right.
All right, Patty, hang in.
I'll try.
All right.
Okay, we're going to stick on the theme of grocery stores. We had a couple of questions about grocery stores. The first one is whether or not grocery stores are providing. Or I'm sorry. Let's start with the cleaning question, and that is there a way to, or should you need to clean fresh produce, and then also what about cleaning other products as well?
Yes, that's the answer. Yes, you want to clean your produce, even outside of COVID-19. That's a whole nother animal about E. coli, and you're sitting here, you don't want any of these other diseases. So, especially in the leafy produce, those have to be cleaned. Even if they say they're washed, wash them again.
Mr. Webb, when you say clean, tell them what, just running.
Just running warm,
Water.
well, sometimes it takes a little, not cool water, but warmer, cool water to get the dirt sediments out. There's a lot of fertilizers that sit in there, and that's some of the things that people get sick from. But there's also bacterial buildup in between the leafy, especially on the leafy stuff. But you should try and wash everything. As far as packaged goods, you should also try and take and wipe down those packages if you're going to put them away. If you're going to put them in use, open them up, throw away the packaging, wash your hands, and start your meal.
Okay.
Okay, and along those same lines, they wanted to know whether or not there's any kind of store pickup available in the local Malden stores.
Store pickup. Can you
What do you
say
mean by
that
that?
a little bit more?
Sure, so that would be like, order ahead, pick up at the curb.
There was that, right? And it got discontinued?
Stop and Shop has a great program. I use it myself. You place an order online,
Right.
and then you get a time to pick it up. That has been canceled. It would be impossible for them to manage that.
Was it canceled because of the pandemic or canceled because it wasn't a good model?
No, the pandemic did it. It's an excellent model. I use it religiously.
Okay.
It's very reliable.
Okay.
But they couldn't. They needed those workers to back
the
up
front
the
lines.
floor. Yeah.
Yeah, so when this is over, Mr. Cocker, we think they'll go back to that, but that's the reason they're not offering it now.
Yeah, there was, and this is the last question before we get to our next caller, and that is whether or not grocery stores are now discuss the requirement of wearing a mask versus not wearing a mask.
We just talked about that. Mr. Webb really educated us because we thought it was a slam dunk, as probably the viewer does. But tell us why it doesn't make sense.
Well, there's a few reasons why it doesn't make sense. I will say this, though. The Asian markets in town went to a number right away because they just were having a hard time managing. They also were requiring masks, and they're still requiring masks to be worn. Stop and Shop does not require a mask, mainly because the store's number has been dropped to the 40% requirement by the guidelines. That's staff and customers. We're checking that daily, and no one seems to have a problem with it. And the store is lightly attended, right? So that's what we're looking for. The other part of it is Stop and Shop, if you think about it, has a large refrigeration. That refrigeration has to be vented out of the building all day long, 24 hours a day, because it's running 24 hours a day. All that, once we lower the amount of people, all of their exhaust goes out with that exhaust. So it got some beneficial effect But we still would say to people, especially if you have a cough, if you have sinus issues, if you find yourself touching your face to maintain your, your nose is running or whatever. If you're blowing your nose or you're coughing, or you shouldn't be shopping, okay? But if you have to do it, and there are people that will have to do it, wear a mask of any kind. Anything to block that transmission of air from you.
So one more time, the 2 Asian supermarkets are requiring customers.
The owners of the market do require people that enter wear a mask.
And what about their staff?
The staffs are wearing masks as well.
Super Stop and Shop, not the case. Now, I thought the other day, or was it today or yesterday, that you felt it also could be a hindrance because employees wearing masks, they're touching them and...
Well, if we get into the restaurant part of it, if we add people to restaurants, takeout or
it was
curbside...
about restaurants, that's what it was.
Yeah, we're going to have people not used to wearing it. And the same in the supermarkets. So there's going to be some staff who can't wear it all the time. They've got to move it so they don't get their hand into a piece of machinery or something like that.
Right.
We have gotten a few complaints about that.
Okay.
Okay, we'd like to thank Karen for her patience. She is on hold, but go ahead, Karen. You are now on the air with the panel.
Okay, hi.
Hi, Karen.
Thank you for taking my call. I have 2 questions. When you have to take your laundry out to a public facility, there should be hot water there. Is anybody checking it? Because it's not always hot water.
Okay. Whereabouts are you taking it?
Both in apartment buildings and public facilities. Public laundromat.
Oh, okay.
We can check the laundromats. That's not usually a complaint, but we can definitely check.
Do you want to call the Board of Health tomorrow so they can get the particulars from you?
You can
if we
narrow
gave you the
our
phone
search.
number?
That'd be great.
All right, that'd be fine.
It sounds like there are particular places you're saying that are not.
Yes.
Okay. Yeah, why
true.
don't you call 781-397-7049. What time?
We're open at 8 o'clock.
8 o'clock in the morning on. And just say you were on the show tonight and you're following up at our behest. And we'll see if we can try to make the assist there.
Okay. And then no, I didn't hear what you said, but okay. Now my next question is the Board of Health or who is checking out the cooks in the restaurants and the fast food places that are allowing you to order food for takeout? Who's checking the cooks?
Okay.
Who's checking the counter servers?
Yep. We have an answer for you, Mr. Webb.
The health department inspectors are doing that. They were we did exclusively restaurants today. We left the supermarkets alone today and the pharmacies alone today. Tomorrow we'll probably do the restaurants again. We're trying to fake them out. We don't want them to know we're coming, and they know we have
so they're not announced.
few a place.
Right.
No, we never announce. But there's so few places open that we have to kind of switch it up to make sure that we're getting them while they're in the act of, they normally would act in a given day.
And
we're having great success with
to give
that.
Karen some confidence, how has compliance been?
It's been great.
Yeah.
You haven't had to cite?
We haven't had to cite anybody, and actually I'm very impressed by some of the things that they come up, just little things in process that they probably wouldn't do other than they really are.
For example, like what?
They'll when they move food product, they're using trays rather than putting it, like say a submarine in a wrap and walking across the room. They're traying it and they're covering it. So it takes a little minute longer, but thank God you're coming in for takeout, so they have that minute. They're starting to realize they can do a little bit extra every time. The hand washing is getting in the way of a lot of expedited orders, but that's a good thing.
Right.
So, yeah, we're seeing a lot of good work out there.
Yeah, and Karen, if you have a place that you don't think is following the rules, again, when you call tomorrow, just identify that to our Board of Health and they'll take a look.
Okay, could you say that number again? Because
Yeah.
I didn't write it down.
Absolutely. It's 781-397-7049.
7049.
Yep.
Thank you so much,
All right.
Mayor Gary
Hang
and
in.
Steve and Chris, and I will call in the morning.
All right,
Thank
we'll
you.
do. Thank you.
Yep. Bye-bye.
Okay, our next question, again, there's been several of these questions. We'll sort of summarize them, and it's about testing. First of all, are the protocols around testing still the same? Are you required to be referred before testing? And is there any plan of expanding upon that testing?
Mr. Webb?
Yes. The plan is, right now, you do have to have a
Referral.
primary care's referral or an emergency room referral. You have to be symptomatic. You have to have 2 of the 5 symptoms. Any 2 is fine. But that's great testing, but if you're feeling it, I don't know why you feel you need a test. You have it. So that's fine, but if some employers are standing by the doctor's note kind of thing, which isn't really relevant right now. But additional testing will start to tell us what percentage of the population never got involved with the virus at all, which is really important as to what do you do? We use that data to say, how do we keep it from ever happening again? Because if those people have certain behavioral patterns or certain age group or sex, it informs us and we can change the way we handle the initial outbreak. It changes completely. I think what we're going to find with this virus is that it's going to come down to a vaccine. It's not going to be anything we do individually. It's definitely going to be a vaccine because it's 10 times more contagious than anything else we've ever dealt with.
Rep. Ultrino, I know you mentioned it in your earlier comments, but there will be a day where testing is commonplace, but it'll take time.
Yeah, it'll take time because there's a few things. We have the 800 million that we're doing for the healthcare industry. So I had a local business call and he said, gee, I'm concerned about my frontline workers and I'd like them to get tested. So there's 2 issues. I wish everyone could get tested, but one is the number of tests that we have, and the second one is the labs. So they are coming out or have come out, and Chris probably knows better than me, is that 15-minute turnaround test, whether you diagnosed it. But our labs, if you have 264 different places plus, we don't have the capacity until we do some mobile labs and stuff. So the 2 issues are getting the tests and B, testing.
And Rep, you think in months? Who knows?
Manufacturers.
I'm hoping it's going to expand again in the beginning of May. That's what I'm hearing. It really comes down to the labs. And the labs are doing yeoman's work trying to get there. It's a very difficult process.
Okay.
Very difficult.
Thank you for that.
Okay, so we are getting up against the end of the show, but we do have a caller on hold. Just before that, we did want to get a chance to show folks at home that we have changed around our resource on the City of Malden's website with respect to COVID-19. So if you'd like to share my screen, and you can see our website. So this would be cityofmalden.org/coronavirus. There's actually COVID-19 also works as well. And we've kind of consolidated all the information. And as you can see, there are many resources here for you to stay informed. We tried to keep this Malden-centric as much as we could, but we do have links to resources, and many of the resources that were mentioned in tonight's broadcast, including, testing, whether or not you should get tested. There's a link here down in your health and well-being that talks about an online symptom checker, which is a really effective way of determining whether or not you should be tested. So go ahead and please feel free to visit www.cityofmalden.org/coronavirus, or you can simply click from the front page. And this is where any big announcements will come, and consider this the hub for all things coronavirus.
Okay, great.
Good job.
Okay, so we're going to go ahead and go to what will be our final caller of the night, and that is David. David, go ahead. You are on the air.
Yes, Mayor Christenson, I just want to thank you for all your staff and your tremendous work, DPW, fire, police, health departments. Thank you for everything you do, and thank you for having this venue where we can call in and ask questions. My question is there any way we can consider reopening with precautions? That's the caveat, reopening with precautions, certain key public buildings, and specifically the Malden Public Library. Right. And the reason I'm asking this is the library it's not just a place to, just to get books. It's for people that may not have anywhere else to go. It is a de facto daytime warming center. It is a place where folks who may not have internet at home, or who may not have a computer, or who may not have a home to go to, can use the internet, can check their email. It's a place where folks can apply for a job, apply for government benefits, apply for a stimulus check. For seniors that may be socially isolated, it's the only place where they have some kind of social life, where they can read the newspaper or find out what's going on and get out of their home. For folks that may be suffering from domestic abuse, emotional, verbal, physical, that's a place where they can get out of the house.
Yeah.
It's a place where
and I know we spoke about this recently, and I really value your passion, believe me. And we brought your concern back and talked with our team internally, and we still just don't think it's a good idea. And I'll have Mr. Webb speak to why that is. But we did consider it, and we appreciated you bringing it to our attention. So why doesn't it make sense to...
Well, we're still in the upswing, and there's still a lot of people who are coming into a positive stage, right? So we've had all this period for infection. We're at the uptick. We're starting to see the hospitals are doing our measuring for us rather than our testing. And as soon as it plateaus and starts to go down again, I think you're going to see the library is probably one of those places that makes the most sense, because you can limit the number of people who are in, you can spread people out, and people are there for a stated reason, typically speaking, and they'll use their time accordingly and then leave and let someone else use it. So I do see that probably coming on as online as one of the first things for people, for the same reasons the gentleman just mentioned, that they're going to need the resources of the library to get into the reimbursement process and unemployment and job search.
Right.
So yeah, we want to get that back up and
Okay.
running.
Thank you, David. And we do want to highlight Dora St. Martin, the director of the library, and her team, who have tried to do as much as they can online while the library is closed.
Thank you.
Thanks, Dave.
Okay, we have come to the end of our questions, and like I said, we will go ahead and look for any unanswered questions. A few people have been very helpful online posting resources. We'll try to get those out to everyone, but we are clear for the docket for tonight.
Okay, do you want to just one more time maybe give your phone number and
Sure.
any other pertinent information and any closing remarks?
I'll go first. I'll be short and sweet. The health department's phone number is 781-397-7049. If you'd rather email, send it to boh@cityofmalden.org. Focus on hand washing. Stay home. If you don't have to go out, please stay home. I know it's tempting when the sun starts to shine. I'm guilty of it too. I let the dog out and then I find myself following him.
Right.
Don't do it. Trust me, just don't do it. There are so many incidental infections that it's not worth it. We're this far into it. We can do what we're doing, and we'll be done with it before maybe New York is. I can see that as a possibility. We may be able to get going before New York does, which is always nice to say.
Right. All right, Rep. Ultrino.
Thank you. First of all, thank you again, Mayor. If you need to contact me, I'm at 617-722-2460. My website's representativeultrino.com, and it has all your state services, links to different services. Unemployment, I forgot to mention, is not only just offered in Spanish now. We'll be adding 4 or 5 more languages for those that need those languages. Or you can email me at steven.ultrino@mahouse.gov.
Okay, great. And just from the mayor's office, if you need to reach us, 781-397-7000, or you can email me at info@cityofmalden.org. And we just want to end by how we began, which is saying thank you to you all. The one thing that we want you to keep doing is to continue the great spirit and harmony that we've seen since this pandemic has started. The most recent story that we're just so bowled over with is Deb Olson from the Disabled American Veterans Association has been working with our Veterans Department, as well as Karen Cologne Hayes at the senior center to deliver meals to Malden's veterans. They just did that this week, and you know, those are the kinds of stories that we're seeing repeatedly, and it's such a great feeling during a difficult time. So on behalf of us all, thank you, and hang in there.
Thank you.